This is the orientation video for the Global Ultrasound Fellowship of UC Davis in collaboration with GECC. In this, you will find information on the general structure of the rotation, the structure of the educational program, and orientation to the places and maybe some of the people you will meet. First off, as a student, resident, fellow, or faculty member involved in this program, you need to know something about GECC. Global Emergency Care Collaborative is an organization, nonprofit, that is run by emergency physicians and partners. And what they are doing in East Africa is taking nurses and building them up to mid-level providers or emergency providers. They have a 2-year curriculum. They start some fresh out of nursing school where some have some experience. The first years are known as junior ECPs, emergency care providers. The second years are known as senior ECPs, and once graduated, they're known as qualified ECPs. All ECPs go through a standardized training process, and they're not allowed to proceed in their training or to graduate without completing and passing their examinations. Your expectation is to be an emergency consultant in the emergency department, also known as the accident emergency ward, and then to train them, the ECPs, in point-of-care ultrasound. You will also be expected to help with existing quality assurance, quality improvement projects, and to be able to identify deficits of knowledge or other issues that need to be addressed within the program. Realize, just like residents, there are different levels of knowledge and training within this program. And so your delivery of education and amount of supervision should change based on the learner's needs. Now, our Global Ultrasound Fellow will travel every year from mid-November to mid-December. And here's your first tip: bring an umbrella. You will get rained on. When you fly in, you'll fly into Entebbe, and you'll almost always arrive around midnight. Now, before you arrive, in addition to getting your yellow fever vaccine, getting your passport, all your papers and educational materials ready, you should have communicated with GECC, and they can arrive for transport from the airport as well as arrange for a hotel overnight. We can also arrange for our hotel separately. We can talk about this in person. Entebbe is on the shores of Lake Victoria and has a nice botanical garden as well as a small market. There are a few good restaurants in the area. Now, the next morning, you will drive out to Rukungiri to Naitchabali Hospital. It's about a 7-hour drive. The driver should be arranged through GECC. Rukungiri is the city that's nearby, and Naitchabali is the name of the hospital. The hospital is a Catholic-run private hospital. Their religious affiliation and better payer mix gives them more capabilities and a little bit more resources than other hospitals in the region, including government-run hospitals. The hospital itself is on a pretty large plot of land, and you'll see that wards are spread out throughout the area. They're separated into male, female, pediatric, fertility, isolation, surgical, and the list goes on. On the hospital property, there is the nursing school, as well as the canteen, which is a location that people come to socialize, watch soccer games, and to buy food and alcohol. The emergency department itself is basically a large room. There are several gurneys in the room that can be separated with curtains if needed. They have no diagnostic imaging except for ultrasound, and they can occasionally get x-rays. There's a medication cabinet where they have several medications. They have a research associate that's always present in the emergency department that helps follow up with patients and complete documentation. And there's supplies available for doing procedures, as well as nursing students always available to help. This location, you should bring all of your own equipment, your own gloves, your own masks, eye protection, things like that. It's a private hospital, and if you take gloves, then the patient will be charged for them. Also, there's no Wi-Fi in the emergency department, and the power is not reliable. Always charge your ultrasound and your other devices when you can, and then bring them charged to the emergency department and keep them plugged in if the electricity is running. Your housing is in a guest house that's on the property, and you should feel safe because they lock the whole hospital grounds during the night. You should always lock your room and lock your house when you can, though. There are several bedrooms in the guest house. There is a living quarters area, a refrigerator, even an oven, although they're unreliable. There's a bathroom in each area of the house. And there is hot water when the electricity is running, but often we took cold showers. Additionally, you cannot flush the toilet paper. Remember to collect it in a wastebasket, and you do have to burn your trash, usually once or twice a week. There is someone that will come by to do your laundry once a week, but you may need to inquire about this specifically while you're there. Also, there are mosquito nets on all the beds, but I would bring your own. There's often holes in the nets. There are nuns that work at this hospital, and they will cook all your meals at the building just next to your guest house. You don't have to eat all your meals there, but let them know if you're not going to be there. They get kind of testy if you don't. You may want to venture out to the local shops or to the city next door to get a meal or two. You also need to go into town if you need anything, like for the bathroom, or if you need minutes to put on your cell phone, anything like that. Notably, there is a charge to stay at the guest house as well as the meals. It is very small, but you need to have local currency. Right when you get to the airport in Entebbe, you should change a large amount of money so you don't have to keep exchanging money as you go. And so you have local currency on you at all times. Also, if you have a phone where you can put a new SIM card in there, you should buy a SIM card at the airport as well and just insert it. It's the cheapest way to get Wi-Fi and to use data within the country. Something they eat all over Uganda, especially in Rukungiri and Masaka, are green grasshoppers. They cook them in some oil, and they actually taste pretty good. If you close your eyes, they taste like buttery popcorn. You don't want to eat the legs. Those can get like stuck in your throat, so make sure you remove them before you eat them if you have the courage. All the teaching or the lectures will happen in the guest house. So make sure you set up the area there, know how the projector works with your computer. And you need a VGA connection from your computer to plug it into that projector. Work it out with the program director, Hillary, before the week starts, so you know exactly when you're doing lecture and with whom. You should do lecture with the juniors separate from the seniors. The seniors may be able to mix with the qualifieds. That should probably be fine. The way I structured it this last year, I would do lectures with the juniors in the morning. I'd be in the emergency department throughout the day, scanning, both in the emergency department, but also going to the wards for interesting patients. And then doing lectures with the seniors or the qualifieds in the afternoon. Things to know about teaching are that there's typically 3 nursing students or trainees in a class, so it's not a large group. They don't have a ton of anatomy, physiology, or pathology training, so you might have to go through some of the basics and really probe them for questions, because they're not going to offer a lot of questions or critiques of what you're doing. Keep it really interactive. They responded much more to interaction, games, competitions, things like that. They're not so used to sitting down for hours of lectures at a time, and that was not the most effective way to deliver information. Also, bringing in drinks or snacks for the lectures went a long way. And for scanning in the department, really have them do all the work. You want them to have the probe in their hands. And you can help them here or there, show them a thing or two, but they're not interested in watching you scan. They need to be doing that work. At the end of your 2 weeks in Nitrabali, have the program director set up another car for you to go to Masaka. Make sure you take care of the bill at the hospital before you go. The program director, Hillary, should help you with that as well. Masaka is about a 5-hour drive from Rukungiri. Masaka is the second largest city in Uganda. It's much more developed than Rukungiri is, and the accommodations at the guest house are much nicer than in Nitrabali. That's why it's better to do Nitrabali first and then go to Masaka. Also, the ECPs at Masaka, they're all qualified, so they've had all their basic training, and you should be teaching at a higher level there, but you will still have to probe them to see what their educational deficits are. Also, this is a large government hospital you're going to be at in Masaka. It's very different than that privately run Catholic hospital in Rukungiri. The government hospital is very underfunded. There are a lot less resources, even though the outside looks pretty nice because it was made by the Japanese not too long ago. But the inside is completely bare bones. There's very few medications. There's no access to diagnostic imaging except ultrasound. They say they can get x-rays, but I didn't see any patient get an x-ray while I was with them in the emergency department. And even though medications and other things are free in the government-run hospital, just the access to them is so limited. Ultrasound can make a huge difference at each of the hospitals. Especially at Masaka, though, it was often the only diagnostic tool we could use, often that and a rapid malaria test. In classic East African style, the hospital's built on a large plot of land, and there's lots of one-story buildings with different wards. The emergency department's marked well, and it's a much larger space, has lots of gurneys and different alcoves within it, as well as a minor procedure room. Both sites, there's no access to ICU level care. Oxygen is not always available, and certainly monitoring is hardly available either. Logistically, at this site, you'll be doing education, teaching at the hospital, but you're not staying at the hospital at this site. There's a few rooms that are available that are really owned by the emergency department folks now. So same typical format, you should plan for education being done in the morning, lectures, whatever you have planned, and then spend your days in the emergency department scanning, just going over cases with the ECPs and trying to figure out kind of what they need from you. If there's downtime within the emergency department, sometimes you can fit in a few mini lectures. Very importantly, at each site, you need to show the ECPs how they can save images, upload images, so that we can do some QA remotely. There's also a small canteen on the hospital grounds and also a place where you can get a Ugandan lunch for very cheap at the hospital grounds. But there are a lot more food options in Masaka, and you can go get other food for a higher price. The guest house is about a 10-minute walk from the hospital. There's someone watching the house 24 hours a day, which is typical for this region. Someone stays there during the day and kind of upkeeps the place, and then there's actually an armed guard at night, which again is very typical for this area. The guest house has a nice living quarters area, lots of different bedrooms, and the power is much more reliable, so you often have running water, warm water, electricity, and don't have as many issues. The program director should really help you with any issues you have with the house, setting up the Wi-Fi, and discuss any logistical issues as far as education. There are some supermarkets in Masaka as well, and you can go shopping and bring food back and make food in your house. There's also a nice expat community within Masaka, so you'll probably meet other people from other countries, and it can be a nice collegial environment within Masaka. Make sure to pay the program director for your housing again at the end of your trip. And from Masaka, it's about a 3-hour drive to Entebbe or Kampala. So get excited. You're going to have some amazing adventures. You're going to do so much good. You're going to meet and work with some great people. And along the way, remember to take lots of pictures, save lots of ultrasounds. These are materials you're going to use for the rest of your career. Above all, be safe, be smart, and represent our program.